Hypertension Awareness Series Episode 3. Why Blood Pressure Matters. Hypertension, the Silent Killer. Good morning. Today I want to explain why high blood pressure or hypertension is called the silent killer and why it must never be ignored. Hypertension is dangerous for one simple reason. It stays silent until the damage is already done. Most people with hypertension feel perfectly fine for years. No pain, no warning signs, no daily symptoms, and then one day, life suddenly changes. You wake up in the morning unable to speak, a stroke has occurred. You are told your kidneys has failed and dialysis is needed, or you collapse with heart failure. Years in the making. Let me be very clear. These events do not happen suddenly. The crisis is sudden, yes, but the damage has been occurring quietly for many years. Hypertension, the silent killer. Let me give a simple example. A 52-year-old man who feels healthy. His pressure has been high on and off. He takes his medication on and off and skips because he feels fine. Then suddenly wakes up one morning, cannot move the arm, cannot move the leg. He has had a stroke. And this is what doctors we see most of the times. Sudden events occurring which could have been prevented. The stroke was sudden, but the disease was not. And the truth is that we all know this story. A neighbor, a relative, a friend who was okay and suddenly gets a heart attack, gets a stroke, gets heart failure. So how exactly does high blood pressure damage the body? First, the heart. High blood pressure forces the heart to pump against resistance every single second. Over time, the heart muscle becomes weak and stiff. Then it becomes weak and eventually heart failure develops. Heart attack is also common with people who have had hypertension. It also causes arrhythmias, problem with heart rhythm. Remember, the heart does not fail overnight. It gets tired slowly until you get heart failure or arrhythmias or heart attack. Second is the brain. High blood pressure damages the small vessels in the brain long before symptoms appear. This leads to stroke, minor strokes, what we call TIA, memory losses, you start forgetting, and also many people just see their concentration is not as good. The third organ is the kidney. Kidney, the small blood vessels that filter are damaged by high blood pressure, and this also causes protein to leak in urine, leading to kidney failure. Kidney failure does not occur overnight. This occurs due to long-standing hypertension. We move to the eyes. High blood pressure also damages the vessels in the eyes, causing blood vision. You can have bleeding in the eye, what we call retinal hemorrhages, and some of the time can cause permanent blindness. Remember, by the time you are losing your vision, hypertension has been there for years. The fifth is the blood vessel. High blood pressure injures the artery walls, leading to plaque buildup, what we call atherosclerosis. This can lead to strokes and also blockage in the legs, what we call peripheral artery disease. The other system is the nervous system. It can cause the autonomic nervous system, causes dizziness, where you find you are not stable when walking. And also from the autonomic can lead erectile dysfunction. High blood pressure damages the small blood vessels and the nerves that are in the penis. And for many men, erectile dysfunction is one of the earliest signs of blood vessel disease, appearing years before heart failure, heart attack, or stroke. So ED is not just a performance issue. It is often a heart and a blood vessel warning. The most important thing to remember is that most of these are preventable. Most of the guidelines emphasize early detection, early treatment. When pressure is treated early, you can prevent the progressive organ damage. Waiting for symptoms is waiting for irreversible harm. And treating hypertension early saves life. What does proper treatment of hypertension lead to? It reduces stroke by 40%, heart failure by 50%, heart attack by 20 to 25%, kidney failure by up to 40%, and reduces mortality by 10%. So we do not treat hypertension just to lower the numbers. No, we treat to prevent the complications and to protect the organs. So what can you do today? Take high blood pressure seriously. Check your blood pressure regularly. Keep your clinic appointments as indicated. Take your medication consistently and combine medication with lifestyle. And finally, if you have hypertension, this is not the end of your story. With good control, damage can be slowed or even prevented. Complications can be avoided and you can live long, productive, and meaningful life. Please share this message to help someone who needs to hear this important information. Hypertension is serious. It's not just the numbers. It is to protect the organ damage. Join me for the next episode where we learn about primary versus secondary hypertension. We'll be answering the question, what causes hypertension? As always, Dr. Beatrice Muthui-Mutua, saving lives one heart at a time.